Name is Alok Kumar. I am from Beltech Multitech Engineering College and my internal guide is Mr. Thomas Robinson and my project is web scheduling with networking community for healthcare. This is my abstract. It's a context based mobile information and also the mobile phone based communication applications. Many applications need the ability to do real time notifications when events occur. Often the people who need to be aware their mobile events are in the remote locations. And finally, it's here to find the contact log from the Android mobile device whenever we require the contact and change the profile mode of the device for our convenient existing system. The current process of the hospital, the patient get appointment from the doctor in a MNC hospital are working available 24 hours, but we cannot meet the correct person or our personal doctor. In the small hospital we working particular time only, so there is also we cannot meet the doctor at all time. This is the main drawback of the process. Proposed system. The main advantage of the proposed system is communicating the patients and doctor through online from anywhere and anytime. The patient can get online appointment and booking process. If the patient have any doubts and queries, they can send the doctor. After that the doctor getting query, he can send the response to the patients. All doctor can send the response to the patients who is registered on our website, because the queries are viewed by all the doctor, so anybody can send their idea to the patients. This is my project hardware requirements, Pentium 4 and something, and this is my project software requirement. Modules: user interface designs, web portal implementation, storage for the MRI image, and designing the reporting to the patients. Module first, user interface design. The user interface contacts of the patient and doctor. Both are member are going to have direct interaction between them. The doctor and patients are supposed to register the site before accessing. They should have the username and password to log in. Thus it is supposed to be registered. Each and every field are validated and inserted into the database. Validation said to be record field validations, regular expressions validation and compare validations, and etc. Web portal implementation. In the web portal implementation, you can dramatically increase the interactivity and usability of your device web application by integrating them to web portal solutions. With portal implementation, user will get a single sign-on, access the personalized view of multiple applications at the same time. It will also allow the help for pre-administrations and customization of the application layout and security. Storage of MRI image, data compressions techniques of magnetic response imaging or description. The image of taken from the control section of the brain. Each image requires a large amount of storage and collectively of patient record. Many requires many image to be stored. The two methods discussed to run length of payment coding schema. Result for both schema are given. Design the report. Patients said to send the report to the doctor in order to know his body status. So every patient sent the report to their specialized doctor in the order to know the patient status. Will a patient sending a report to doctor, patient have the send his or her age, gender, material status, health, height, weight, and any habits such like something smoking, and any discuss such like liver, kidney, and some things. Reporting to the patients. Doctor is said to the view the patient report. After viewing the report, the doctor is said to send an appointment to his patient. The appointment from consists to the patient name, appointment date and time, and clinic, hospital name and address. Those the report are sending to the corresponding person respectively. This is my project use case diagram. Left side first is patient, another one right side to have, one is doctor, another one is admin. Admin is nothing but storage the data from the or manage the data from the patient and doctor database records. First one is patients. First register and after that login, after that send it to the doctor and get the appointment and view the doctor report. Another one doctor, first one register and login and view the patient detail and send it to the patients, and final one is admin. Previously I will tell that admin work. This is class diagram. We have totally 4 topics. One is doctor and department, appointment and patients. It's totally having the hospital. Year diagram. The patient first one is enter the detail for the genders, address, mail, mobile number, username or name, password, date of birth. It also same as doctor. Date of birth, name, mobile number, username, password and gender. What is the specialist of the doctor? After that my project screenshot. First you can see the right side corner in the top place. You can see the two options. One is login, another one is sign in. Previously you can register that options. You can click that option, login option. You can see the two options after that. One is doctor login, another one is patient login. First one is patient login. You can enter the click the patient login. You can see the username and password. After that you can click the login button. Previously you can see the forgot password options. You can see the several options. After that you can change the password and view the profile, change the profile, view the doctor report and send it to your report to the doctor. You can see the enter the your full detail and you have what are the problems. After that you can see the your full detail, entered detail. After that you can click the another one doctor login. You can first enter the username and password and click the login button. You can see the same several options for change the password and view the profile, change the profile and view patient report. You can see the patient report, that particular patient report, height, weight, male, what are the problem to have that patient. And after that you can give the appointment for give the appointment to the patients. First one is appointment date and time and what are the clinic and clinic address to submit. Conclusion. The project played a virtual role of agent on the online service being available worldwide. The patient obtained the MRI scan and diagnose and treat medical conditions in MRI is non-interactive and painless medical test that allows the physician to better they evaluate the part of the body and certain the discuss diseases that may not be occurred accurate with other imaging methods such as X-ray, ultrasound or computer tomography.